Motivate Your Monday on Good Morning Washington is sponsored by Nova Physician Wellness Center.
A safe, affordable, and sustainable way to lose weight is exactly what our friends at Nova Physician Wellness Center provide for their patients every day. And here to share more about their programs is Dr. Chaudhary. Welcome back to Good Morning Washington.
Thank you.
You've helped so many of our viewers already, and we're going to help so many more. I know we are. Let's talk about how medications have become so popular in the recent years when it comes to weight loss management. Why is that?
You know, the most important thing is that these newer medications called Wegovy and Zepbound are approved by FDA for the obesity management. And why they've become so popular is because they are actually the game changers. So these are the medications which are much more effective than the previous medications we used to use. They are also safer, and more importantly, they have a better compliance. The patients have a better compliance because their ease of convenience of using them. They're just once a week shot. So more importantly, I think what physicians really like these medications more is because they are not just there to help you reduce your appetite. These medications actually work on fixing the crux of the problem, which is your underlying insulin resistance.
You know, we've talked about this before, that as a physician, your goal is to have people on the least amount of medication as possible. So people are concerned if they get on the drug to lose the weight, after they've lost the weight, do they have to stay on that drug? What's your message about that?
Well, I'm glad you asked me this question because this is a question that I get asked over and over again by all my patients. Doc, do I have to be on these medications for the rest of my life? And my answer is yes and no. Yes is for the patients who are just using these medications as just an appetite suppressant, and they're really not working on the lifestyle modification, so they probably will have to use them for a long time, which may not be the very best way to lose weight, because you really don't know if you're losing weight in a healthier way, if you're able to lose this body fat and maintain the muscle mass, because body fat is what is eventually causing all these chronic medical conditions. So you want to lose weight in which you're targeting the body fat mass as opposed to targeting the lean body mass. And second of all, the patients who are actually following a good lifestyle modification by talking to the doctors and talking to the dietitians are the ones who are able to come off of these medications. Many of my patients are actually weaned off eventually after taking it for a few months once they reach a decent goal. So even though these medications are covered for chronic weight management, but you know, in my practice as an obesity medicine physician, as you said, I like to keep my patients on the least amount of medication. So I try my best to take them off and keep them on the minimally necessary medications.
Well, we met one of your amazing patients who lost over 100 pounds working with you with the weight loss management program, and of course using the drugs as well. Let's listen to Deborah's story.
I've struggled with my weight my entire adult life, and always able to keep it under control with medication, and then all of a sudden that stopped. And I had tried every weight loss program available, even surgery. Nothing for the long term. I would lose, gain it back. So my doctor told me, your numbers are really bad and medication's not going to do it anymore, so you need to start losing weight. And that's how I found Nova Physician Wellness. I went there. Their team treats you as an individual, a plan for me specifically, and I lost 120 pounds in about 18 months. And I've been able to keep it off for more than a year. It is possible. I just say, just go, talk to the practice, talk to their providers in their practice. They're such a great team, and they care about you. You know, out of that 120 pounds I lost, they made sure I lost it in a healthy manner. Only 20 of it was muscle. That's like remarkable.
That is such an incredible story, and you've helped so many people in this region. The next question I think that people have is the weight management and the newer drugs covered by insurance?
So the weight management as such, the doctor's visit, the dietitian visits are all covered through your insurance. For when it comes to medications, most major insurances are covering it, but we do have to get a prior authorization, which means that the doctors have to put a medical justification, which we would do for you when you come to us. So we do a full medical evaluation on you, and then we prepare a good prior authorization so that we can get these medications covered through your insurance.
Dr. Chaudhary, thank you so much for all the people that you've helped that are watching right now and all the people that you will continue to help here in our region. Thank you so much for your time.
Thank you for having me.